floor specialist and certified sex counselor and educator. And thanks for joining myself and Dr. Amanda Olson here for a live Q&A chat to get all your pelvic floor questions answered. Before we get started with this interview, I want to give a special shout out and thanks to our Men's Online Pelvic and Sexual Health Summit sponsors, Mainspring Medical featuring VacuRect, Intimate Rose, Firm Tech, Mystery Vibe, and Clinical Skills USA. Without your support, this event could not be possible. So thank you so much for supporting pelvic and sexual health wellness for people. All right, Dr. Amanda here is a doctor of physical therapy. She's also a pelvic expert behind Intimate Rose pelvic health products. Some of those including my favorite pelvic wands, vibrating ones. There's also rectal trainers and vaginal trainers, and a new one that just came out. Dr. Amanda? Oh yeah. Work it, girl. Yes. Tell us what that is. Because people probably are like, is that like a kid's toy? What do you do with that? Where do you put it?
This is another offering of our pelvic health wand lineup. You'll see here that we included the same blunt tip on one end and long thin end on the other, but it is the brand new extended reach bendable wand. So it's a wand that serves the purpose of providing people with the opportunity and empowering them to do myofascial release, tender point release, and soft tissue mobilization to their pelvic floor, either through the rectum or the vagina. And it is bendable to meet their unique anatomical needs and provide an extra reach.
That's right. Oh, I love how accessible it is and also fun and playful. Like, come on, y'all. Like, who doesn't want to, like, as a sensory fidget toy, you just want to play with it, right? Exactly. So, Dr. Amanda, let's talk about some of the conditions that might benefit from a pelvic wand.
Absolutely. The pelvic wand, its primary category would be to help people address overactivity of the pelvic floor, which encompasses pelvic pain, pain with orgasm, urinary urgency, tender points, tailbone pain, pain with sitting, pain with ejaculation or orgasm, or those who have soft tissue restrictions or scar tissue following cancer treatments or surgery. So, radiation, chemotherapy, laparoscopic procedures, post prostatectomy, all of those where the pelvic floor muscles might be tight or restricted or have knots in them, just the same way we get in our neck or in our back, or scar tissue. So it allows people to be able to reach inside and do gentle mobilization and massage, almost like a back scratcher, but for the pelvic floor.
Right, exactly. It's like an itch that you can't scratch, right? And it's like once you get to that spot and you're like, oh, that feels so good. And so having these accessible tools is so important in pelvic therapy treatment and support. And just so folks know, like when we're talking about the pelvic floor, I have my female genital model. I also have my male pelvic model here that we can describe. But we have these superficial muscles that are in the front that wrap around the genitals themselves, like the clitoris and the vaginal opening, and here's the urethra. The deeper pelvic floor muscles are the levator ani, and so when Dr. Amanda is talking about like pelvic floor soft tissue work, etc., it's using this device internally, either vaginally or rectally, to really address those hard to reach areas that are inside of our body, because that's where the pelvic floor muscles live. They're a group of hammock-like muscles that go from the pubic bone all the way from your tail to your tailbone, and they help support the pelvic organs. So rectum, the uterus if you have one, or the prostate if you have one, and the bladder, that all live in these spaces. And just for comparison, because there is much more similarity than there is differences when we're talking about pelvic floor. The genitals may be oriented a little differently, but the function is really the same. So you have the superficial muscles here on this male model. Again, a triangular group of muscles. The genitals are mostly outside of the body in those that have penises, versus for those that have vulvas, vaginas. The erectile tissue, or the genitals, are mostly on the inside of the body. But again, different orientation, same function. We've got the external sphincter and then the deeper pelvic floor muscles, again, supporting like bladder, the rectum, and then deep underneath there is the prostate. There's one condition, and we get this question a lot, Dr. Amanda, is painful erections or ejaculation. The wand, is accessible specifically for getting these points. And I want to make sure that people get that like you can actually help support and reduce painful ejaculation by using the wand and accessing points that are right behind the pubic bone, far up here. And so you can tailor it to your body. You can flex it, shorten it. Yeah, yeah, there you go. Exactly. It's fantastic. It is so fantastic. And again, y'all, like, I fully support and endorse such accessible products. Like it's all things aside, like these are my favorite pelvic health treatment tools because they empower people to take pelvic health and their concerns into their own hands. And that's exactly what you did, Dr. Amanda. So thank you.
Thank you so much. That makes my day.
Yes. Rick says here, hello, hello, everyone. Hi, Rick. We say hello to you as well. And thank you all who are joining us and just chiming in. We did get a question, Dr. Amanda, about the ischiocavernosus and bulbocavernosus muscles. And I'd like to repeat that.
Yeah. Yeah.
I'll let you take that away. Go with this question of what are these muscles and what is their function?
So those are the superficial pelvic floor muscles, and they are extremely useful in sexual functioning and appreciation. They are somewhat assistive in maintaining urinary continence, so preventing the loss of urine. But they also lie adjacent to other really important structures that are highly innervated. So there's a lot of nerves and sensory experiences in those places. And so they need to be both strong to help support, but flexible and mobile. And they need to have the ability to relax in order to enjoy and have pleasure around sex.
Mhm.
And they need to be able to contract in order to support closure around the urethra when we're doing things like coughing and sneezing and laughing.
Totally, exactly. They're the main muscles that help with erection and ejaculation. Clitorises and penises, because they both have erections and they both have ejaculation processes, which most people don't know about. So I'm just gonna say that and leave it there. And leave it there. But you're right. These muscles are so important, and they have a network of nerves that really supply the area for sensation, for touch, and detecting other things. And when things are tight or tense or uncomfortable or painful, that can significantly inhibit the function of our genitals and also just our own safety in our own body to be able to poop, pee, or have sex. So, doing these self treatments are going to be really important. And we have a question that came in here. Any help for the tip of the penis pain? So just some anatomy orientation here. Tip of the penis is here. This is the glans. And we have this dorsal nerve to the penis that is on either side. So this model doesn't really show you both. It's just a teaching tool, but there's two on either side, quite superficial. And that's the supply to the actual shaft of the penis, skin, and the urethra and the glands. So Dr. Amanda, how might, pelvic therapy support reducing tip of the penis pain?
We can help reduce any restrictions around the nerve at the muscular level by reaching, as Dr. Susie was pointing out previously, where the muscles lie. In from a mobilization standpoint, we can reach those muscles from the rectum by coming forward, and certainly the bendable wand, as you can see, basically in this angle here, it
Mm-hmm.
looks really scary. I promise you, it's not, but it's used to just gently glide forward and reach to that tissue, and you can just gently mobilize it just the same way if you had a knot in your back and
Mm-hmm.
you rubbed on it and it relieved the pain, but when you pushed on that pain it was zinging up and over your head and you were getting a referred pain. Likewise, that's what's happening here. So we can make sure there's great blood flow to the area and no restrictions around the nerve and the blood supply.
Absolutely. And really reconnecting with this part of your body, especially if it's been hurting, it's so important to find areas that feel good and pleasurable so that the danger messages can be snoozed. Because right now, all the alarm bells are going off and not a lot of snoozing. So, really, the idea with touch therapy, self touch therapy, or offered by a qualified pelvic therapist, is really to help put the snooze button on these alarm bells that might be driving some of the pain sensitivity. So amazing. Oh, we got more questions coming in here. Okay, Dr. Amanda, what are the best ways to strengthen these muscles?
So, pelvic floor muscle contractions are also referred to as a Kegel. A lot of people associate Kegels with new moms or women, but at the end of the day, a pelvic floor muscle contraction is called a Kegel. And if you recognize that your pelvic floor muscles are indeed weak, then they can be strengthened. The best cue for men, Dr. Susie, I would love to know yours, but what I have found clinically is the best cue to activate the pelvic floor muscles is to imagine that your penis is a telescope and you're going to pull it up and into the submarine and your body is the submarine. Susie,
I've
what do you use?
I have first of all, I've never heard that one, and I like it. So thank you for that. Yes, I am not as creative with my cueing. I honestly just go, "Hey, shorten the base of your penis or shorten your penis." But not many penis owners like to think about shortening their penis. It's only temporary. Everyone like it's
Yes.
not permanent. The other cue is stopping the flow of urine. So that's really going to address that superficial layer that's intimately connected more to the sexual organs as far as that cue goes. But then the backside, stopping, holding back a fart. Imagine that you want to hold back a fart. We've all done it. We've all done it. So you've actually been acquainted with these muscles before. And I would say, if you really are having a hard time getting in touch with, contracting your pelvic floor muscles or knowing what they do or where they're at in your body to feel them, go ahead and try to stop the flow of urine while you're peeing. I wouldn't suggest that. I'm sure we wouldn't suggest that to do that as an exercise because we want to let go and let flow when our bladder needs to empty. But if you're looking for a feeling of what that's like to engage these muscles, that would be an experiment to try, is stop the flow of urine midstream. Yeah. And as far as strengthening goes, I mean, so Dr. Amanda, you're hitting the nail on the head here, is get to know your muscles first, because many people don't know how to do a proper pelvic floor contraction. And that's really our biggest role, is to help people connect with their brains and their bodies and to help with that neuromotor firing. But how do we really get like strength built up? So once we kind of get a sense of these what these muscles do and we can isolate them properly, what do we do to really kind of strength and work on strength and endurance? Any
It's all
tips?
about, yeah, it's about volume and they are muscles just like other muscles. And so we actually use the same kind of exercise prescription that we would use in any other type of physical therapy or rehab, or that a personal trainer would use.
Hmm.
So a 3 to 5 second hold, 8 to 12 reps for 3 sets to build strength. Endurance is going to depend on where you start. If you are starting with able to contract and hold for about 5 seconds, then we might try to do 5 seconds for 10 reps, 3 sets, and build that 5 second out in service of being able to hold a full bladder, or
Hmm.
being able to have more intense orgasms and having better endurance around the muscles there,
Hmm.
if your muscles are indeed weak. And then additionally, because the pelvic floor muscles share a fascial plane with your gluteal and hip muscles, we then want to tie those pelvic floor muscles in with regular everyday strengthening of the gluteals
Yes.
and hip rotators, which a lot of us in our modern jobs are not getting a great opportunity to exercise. So that
Hmm.
would look like squats, bridges, planks, um,
Hmm.
strengthening the hip rotators by lifting a leg while you're in a plank. All of those
Hmm.
exercises are conducive to helping the pelvic floor.
Perfect. That's beautiful. And I love how you tied in the functional aspect of things. It's like, hey, if you want to help support your pelvic floor in particular activities, whether it's weightlifting, running, etc., we need to use these muscles functionally and help them adapt to the load demands or the tissue demands being placed on them. So, super helpful and obviously very individualized. So, if you're looking for an individualized or personalized program, please talk to your pelvic floor therapist. Okay. All right. Wow, we got these questions coming in. Okay, here we go. I started using a prostate massager. Any advice, please? Well, golly, there could be a lot of advice around using a prostate massager. Rick, do you have anything specifically? Like, if you can be a little bit more specific with the what you were asking, that would be great, so we can hone it in. Let's see. What is hard flaccid and how common is it and how do you prevent it? Dr. Amanda, your thoughts on hard flaccid?
Mostly, what I've observed is that it's associated with pelvic floor muscles that don't have great timing and coordination, sometimes due to restriction around the nerves that's impairing the ability for the muscles to fire, sometimes restriction in blood flow to the area as well. So, exercising in both directions. So, making sure there's good mobility and making sure there's good strength. And that can oftentimes help improve blood flow and circulation to the area. Sometimes it's associated with some sensory issues
Mhm,
as well, where people are just not able to sense or perceive what the touch is or what the stimulus is. So getting them acquainted with different types of pressures can be really helpful. Dr. Susie, what do you do?
mhm. Yeah, so with hard flaccid, essentially it's what you're saying is that there's a bit of this confusion or disconnect with muscles and nerves that are firing in this area. And essentially, it may or may not be associated with pain. Typically, the onset is associated with some physical and or psychological inciting event. So it's some sort of traumatic event, whether it's direct or indirect, physically or emotionally, and that sends the alarm bells going off and very wonky. And so people might describe their genitals as rubbery, alien, weird, hard when not genitally aroused or or mentally aroused sexually. So there's a bit of like overlap as far as like complex regional pain syndrome kind of stuff where you definitely get like peripheral sensitization. All that means, y'all, is that nerves to the penis get sensitized, the messages to the muscles and nerves get a little confused, and the brain's really having a hard time with all the messages that are coming from this part of your body. And so what Dr. Amanda was saying is that helping with improving the communication between muscles and nerves, increasing circulation and blood flow, and also reducing the anxiety and worry about what is going on in the penis. Because yes, sometimes hard flaccid, which is a cluster of symptoms, it is not a diagnosis. I just want to put that out there as well. We really don't have a lot of literature or scientific evidence around hard flaccid. It is relatively new. If you go to your urologist or another medical provider, they may not even know what that means. The pelvic therapists in your world are going to know that a lot more about that. Although, again, we're really just extrapolating based on biologically plausible reasons for why someone is experiencing changes, sensory changes, or functional changes to their penis that is outside of any direct pathological cause or contributing factors. And so it is a cluster of symptoms, and the community out there has coined them as hard flaccid. And again, we would address it through this perspective of sensory reintegration, helping to reduce symptoms, pain, worry, increase circulation, increase neuromotor control, and reassure you that again your body is safe, and trying to help you re-engage back to sexual activity, pleasure, self-stimulation, and or partnered experiences, because that's what's going to help your brain and your body reduce those bodily protective responses. So wow, that was like a mile a minute. I'm gonna pause there. Oh, so we are like inundated with so many questions. Okay, y'all, we won't be able to get to all of them here. Let's see. I'm using a biofeedback machine to learn how my body feels internally when my pelvic floor tension is so intense that it feels the way muscles ache after an intense workout. Any additional advice, Dr. Amanda?
Absolutely. So, biofeedback is such a wonderful tool because it allows you to start to understand the connection between what you're sensing and what the muscles are actually doing. Because oftentimes there is a disconnect and we're not aware that we're clenching.
Hmm.
So, that is a really powerful learning tool to help re educate the brain and ensure that the brain and the pelvic floor muscles are both. I always compare it to the brain might be speaking French and the pelvic floor is speaking English, getting everybody on the same page, communicating together. And then also addressing the soft tissue. What you're describing as that ache is often a product of clenching around muscles and nerves, blood flow and nerves that creates that ache sensation. The same way as if you were walking around with your shoulders elevated up in your ears all day, you would have achy
Mhm.
shoulders or after a hard workout. And that's
Mhm.
where using the wand too is a
Yeah.
really powerful tool to do myofascial release throughout the muscles. That's going to help introduce brand new blood flow to the area.
Mhm.
It helps with lymphatic drainage in the area, and then also to resolve any tender points that you might have that are driving that ache sensation.
I love it. That's awesome. And to your point, Dr. Amanda, any tool, whether it's a hand, a pelvic wand, a rectal trainer, a mirror, or a surface EMG, which is surface electromyography, if we're talking about the biofeedback type machine, that's just measuring neural activity to muscle, which is one aspect of tone. Any of those can be a source of biofeedback. Any of those can be a biofeedback training tool, right? You don't necessarily need to have a machine to kind of get feedback. So many ways to go about that, which is why you have creative pelvic therapists who know how to overlap and offer some other treatment options if you're looking for more of that. So, okay, let's see. We'll just do one more. Let's see. Why? We'll do this one. Let's see. Why does the penis lose sensitivity over time, and can this be prevented? Dr. Amanda, do you want to take that one?
Sure. So that also, I think, speaks to the dynamics between sensory and your mental exploration and what your body is feeling over time. The brain can become bored. So sometimes the same type of touch and stimulation can become boring, and the brain is like, wah, 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 I don't
Yeah,
hear you. I don't want this.
right.
um,
I want something new. Like, yeah, novelty. Our brains love novelty.
Yes. And then additionally, it could be musculoskeletal and physiological as well. Physiological, speaking to changes in hormones that can be associated with stress and health status if you've taken new medications, or if you
Mhm,
are going through really busy days and your nutrition isn't quite where it needs to be, or if you're struggling with your partner,
mhm.
that can also drive some of these issues as well. So we have like it's like all of the above, as Dr.
Yeah,
Susie touched on with hard-flaccid. Like a lot of those symptoms are
yeah.
similar there.
Yeah, a lot of overlapping. And you're an ecosystem. So I like to tell people like your genitals don't live in a vacuum. You're human first with all these parts. And so yes, the biological factors do matter, as you alluded to, Dr. Amanda. Certainly any type of medical changes, whether that's from surgery that impacts the nerves to this area. And again, this can happen for both folks, people with penises, people with vulvas and vaginas. You can have sensory changes throughout the lifespan, and again, some of that does have to do with like the aging process. I hate to say it, but yes, some of our nerves get sluggish over time, just like you have to work a little harder to strengthen your muscles when you get older because of these natural changes that occur, but you're not doomed. And Dr. Mana said, use some novel sensory stimulation. The Intimate Rose has a vibrating wand. Prostate massager. Someone asked a question about that. Stimulating lubricants, right? Adding some fantasy or some mental stimulation in different ways, having more fun and playfulness. So there's opportunities to expand your sexual repertoire and menu that will help to stimulate the nerve endings while also helping you to connect and enhance your pleasure experience. I did also want to mention how important it is to have optimal cardiovascular and neurological health, because cardiovascular health issues are huge sexual disruptors, and especially of the arteries and nerves in your penis and or clitoris. They're tiny, tiny arteries, folks, and nerves need blood flow to thrive. And so if you have cardiovascular heart disease, generally those signs and symptoms are not going to show up right away. It can take time and incremental changes over time, which is difficult, right? Because we can't see what's going on the inside of our bodies. So we, when we eat, when we drink those five, maybe Pepsis a day, and we might not have an issue that day, but it's an accumulated effect over time. And I'm not saying that Pepsi or Coke is bad. I'm just saying that, like, there's an overall burden on the system environmentally, what you're eating, how you're treating your body. All of that matters as far as this vessel. And it's like a car, if you don't change the oil on the car, you don't take care of your car, you're not going to get a lot of mileage out of it. You're just going to have more problems, and you might not have it right away, but it's going to accumulate over time. So you better deal with it now than later. So yeah, exercise, aerobic activity is going to be important. And making sure that your blood sugar regulation is great. Diabetes, again, can cause neuropathy to these structures and really affect erectile function. So I will pause there because we have really taken a lot of your time, Dr. Amanda. So, any parting words for our audience? I mean, thank you so much for everyone who is here. Really, thank you so much.
Yes. Thank you to everyone who's here. And if you have additional questions, don't hesitate to reach out. Whatever it is that you're dealing with, there are solutions, and
Mm,
you are not alone. It's just not commonly talked about. And I know that it's really hard to discuss these kinds of sensitive pelvic health issues, but
mhm.
we are always here for you.
We totally are, definitely. And again, join us again November 9th through 10th for the Men's Online Sexual Health Summit. That is sexualhealthsummits.com. And a special gift from Dr. Amanda for $20 off your admission tickets. If you can't make it live, don't worry, you'll get the recordings. But take advantage of this opportunity. Use coupon code Amanda, all caps, AMANDA 20, Amanda 20 at checkout for your $20 off. And join us there, because the conversations are just going to keep coming. No pun intended, or did I? Okay. All right. Thank you, Dr. Amanda. And thank you again, everyone, to the YouTube community. Thanks so much for your support. Without you, we would not be able to have this important sexual and pelvic health information out there for people to be educated consumers and advocates for their pelvic and sexual health well-being. Thank you so much, Dr. Amanda.
Thank you for having me.
Bye.
Bye.